My name's Alan Erickson. I was born and raised in Nebraska. I went to undergraduate at Nebraska Wesleyan University, and I did my medical school at the University of Nebraska Medical Center. Did my residency and my fellowship at Fitzsimmons Army Medical Center in the military. After that, I spent some time in the military and then eventually returned to Nebraska to be part of the academic program. I really enjoy internal medicine, and I enjoy taking care of diseases that are of a chronic nature. In rheumatology, we also do a lot of detective work. A lot of times our diseases are difficult to diagnose, and patients end up seeing a host of different physicians before they get to us. And oftentimes we get to see patients in different stages of life. So we see young people and older people, and those are the things that I really enjoy about rheumatology. The most common diseases and conditions that we treat in rheumatology include osteoarthritis, the crystal arthritides like gout, and there's other diseases that can be related to crystals. We also take care of rheumatoid arthritis, lupus, and then there's a host of other autoimmune diseases which are less common, like vasculitis, scleroderma, and Sjogren's syndrome. I chose the medical field and chose to go into medical school when I was fairly young. I think I was in junior high, maybe early high school. It all started with the illness that was surrounding my grandparents and how I saw the physicians and the nurses interact with my family, and how important that became to not only the healing process for the patient, but also, I think more importantly, the healing process for the patient's family. One of the focuses of academic medicine obviously is taking care of patients, but the other focus of academic medicine is teaching physicians and other healthcare providers and also doing research. And it's the taking care of patients that is also benefited from having students work with us. Students help keep us sharp and keep us current, and the researchers bring new and exciting things that we can use to help take care of our patients. It's important for patients to be able to tell their story. Oftentimes patients have a very complicated set of circumstances and have seen other physicians. And so I try to be an active listener, and I allow them to tell their story. And then based upon the story that they tell, I will ask other additional questions and then come up with a treatment plan to try to solve the problem and treat their symptoms.